when you got your diagnosis. I fell apart.
I know, and so did your sister. And I felt I needed to prop you two up, and your dad.
My mom's lung cancer diagnosis 2 years ago was a stunner, and not just for me. She isn't a smoker.
There is a stigma, no matter what. And the first question people always ask is, did you smoke? Or they'd say, but you don't smoke.
Neither do 60% of new patients, experts have noticed.
It's becoming a very big epidemic among non-smoking women.
What hasn't changed? 85% do not survive.
Why hasn't the mortality rate changed in 40 years?
Most lung cancers are diagnosed when they're already advanced.
Here's breathing instructions.
Unlike breast, colon, and prostate cancers, there's no screening protocol for lung. A fluke CT scan ordered for something unrelated spotted my mom's cancer in the earliest stage when it's operable, but that's rare.
You really want for other people the benefit of the information that you got at the stage you got it.
Everybody should have the chance I got, because it's my life. And I sit in the office every 3 months and wait and see all the other patients come in. And I can tell the ones that weren't as lucky as me.
Breakthroughs are happening right here in Boston, but not soon enough for most. The average lung cancer patient lives only 1 year.
The progress we made in the past 5 years is probably more important than the progress we made in the previous 80 years.
This is actually a slice of my mother's tumor, her lung cancer, and we brought it here to Mass General, to this research laboratory, to test it for some key information that hopefully will help her in the future if her lung cancer ever comes back.
Mass General is using cutting-edge DNA tests to analyze patients' tumors. Some have specific genetic mutations that, when identified, can triple a patient's lifespan.
This is the normal peak that we see for this gene BRAF. And here in your mother's sample, we actually see a mutation in this gene.
When you see these kinds of things, you realize you don't have to use the standard chemotherapy for lung cancer, correct?
Exactly. There are other options.
In some cases, a pill with almost no side effects, capable of melting away tumors, but only when a specific genetic mutation can be found.
Shouldn't all lung cancer patients have their tumors tested?
Yes, unequivocally. I think so, yes.